Cosmetic Botox and herbal supplements. Can you take on a daily basis cod liver oil, wheatgrass, spirulina, and chlorella tablets if you have cosmetic Botox and Juvederm injections?
Thank you for your question. You're asking if you can continue to take daily supplements such as cod liver oil, chlorella, spirulina, and wheatgrass if you're considering undergoing injections like Botox and Juvederm. Well, I can certainly give you my perspective on this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I specialize in, amongst many things, in facial aging, and injectables such as Botox and Juvederm is something I've been using for years, and we use in our practice every day. So when you ask a question like this, it's probably helpful for you to understand a little bit of what the doctor's thinking is when it comes to various types of supplements, as well as medications, and for that matter, medical conditions that you currently may have. When we do injectable treatments, we want to minimize certain risks. And of course, the concerns that we always want to do is we want to avoid any risk of infection. We want to minimize the risks of bleeding. The reality with most injectables is that when you're entering the skin with the needle, you can get a little bit of a bruise. So generally it's advised to avoid aspirin and Motrin or non-steroidal anti-inflammatories. Something like cod liver oil falls in the omega-3 fatty acid family, and it tends to be considered a bit of a blood thinner. However, it's not necessarily, in my experience, a very strong blood thinner, at least in terms of injectables. When we do more invasive procedures, such as facelifting surgery or eyelid surgery, I generally advise people to stop taking their fish oil and or other omega-3s like cod liver oil for at least a week prior to surgery. Now, the challenge for you is to also understand what kind of Botox and Juvederm injectable procedures you need. And you have to figure out how does that fit in with the risks that I just described, mostly in regards to potential bruising. A lot of times doctors are judged by whether or not they created a bruise. And it's a bit of a little bit of control on the doctor's part, where there's opportunity to use different methods, such as very tiny, small needles, as well as various types of different blunt cannulas to minimize bruising. At the same time, the minute you enter the skin, you might just have the fantastic luck of just hitting a tiny little vessel and creating a small bruise. So to minimize those risks, very often people do stay off of blood thinners. But I would say that a lot of times that patients don't often know whether something is a blood thinner, and very often they need to have a Botox injection or a Juvederm or any filler in an urgent manner because they have a special event happening in a couple of days. So there are different ways to actually make an impact to minimize the risks of bruising. As far as I'm concerned, if someone like yourself came to my practice and told me that you were taking these supplements, I really wouldn't have any issue from a bruising risk factor. As far as the effect on the injectables themselves, I also think it really isn't important. When you think about the mechanism of the two types of injectables, and just so that you understand, Botox is considered what's called a neurotoxin. It means that it interrupts a signal between a nerve and a muscle. So, for example, if you inject Botox around the crow's feet lines, you reduce the activity of that muscle. That's in contrast to Juvederm, which is a hyaluronic acid filler. This is something that adds volume. So You can place a filler like Juvederm in anywhere from nasolabial folds, the cheeks, the jawline. You can place it in a lot of different areas. It's a different issue, but in the end, it's not likely to be a problem. I think it's very important that once you've met with a doctor that you feel comfortable with, that you establish a rapport and get that specific doctor's personal perceptions on what is relevant for you in terms of the supplements you take, as well as other medical issues or medications that you may be taking as well. Every doctor practices in a way that they're comfortable with, and they will always have good reasons for, or typically will have good reasons to make recommendations as to what they prefer for patients to take or not to take before having different procedures. That is the art of clinical practice. So meet with a qualified, experienced doctor who does Botox and Juvederm, and learn and see if you're comfortable with what they recommend, and then move forward. I think you'll find that as you start doing these treatments, you yourself will learn a little bit about what is ideal for you before you have these injectable treatments, so you can plan them in the best way you can. So I hope that was helpful. I wish you the best of luck, and thank you for your question.